Heyo, what's going on, everybody? Thank you for joining this second YouTube live with DNA Physical Therapy, me, Dr. Nader Amer, and still new to all this, so please bear with me with what's going to happen. We're going to get started here. I started a little early because last time we had some issues. So let's see how we are going here. Perfect. Heyo. All right. So let's see. We got about 2 more minutes. Let's see if we have any questions so far. Any comments? No. All right. Perfect. All righty then. Let's get started then. All right. So here is Common Triathlete Injuries, Discover, Prevent, and Heal by DNA Physical Therapy, Dr. Nader Amer, DPT. That's me. Next. Oops. There we go. So a little introduction about myself. My name is Dr. Nader Amer, 10 years experience as a physical therapist, lifelong athlete, played football, soccer, swam through college, D1 athlete, pretty much know a lot about athletics and physical therapy, passionate about rehab. I nerd out about anatomy, read a lot of research articles, and try to keep myself up to date on any of the most recent research out there so I can provide the best care to my clients. So brief overview of DNA Physical Therapy. I am the owner and only employee of DNA Physical Therapy at the moment. We provide physical therapy services, in-person sessions in the clinic or at your home, office, or gym. And I also offer virtual sessions. We can book, all of these can be booked through my website at dnaphysicaltherapy.com. And there's under the services tab, you can request for a 15-minute free virtual session with me. And we talk about what your goals are, pain, issues like that. And we can set up another virtual session for physical therapy services, an hour and an hour and a half. We also provide strength and conditioning, one-on-one strength training sessions. We have a world-class gym here at DNA Physical Therapy with over 1,000 pounds of weights and resistant bands, dumbbells, exercises, balls, everything. And we also provide workout templates. So if you're just focusing on trying to get into shape, aesthetics, athletics, we customize those workout plans for you. And then also on my website, there's injury toolkits for shoulders currently, and we're working on getting hips, as in Nader is working on hips, back, and knee templates for the future. Wrong thing again. Next, what is the agenda for today? Today's objective is to educate. So educate common triathletes, whoever's on this live stream that wants to be educated on injury prevention or how to keep yourself safe, how to train, how to begin to start to prepare for triathlons. This is for you. What you will walk away from knowing is the importance of physical therapy. Common injuries with triathletes. We're going to go down from the spine. We're going to start at the neck, shoulder, back, hip, and knees. That's what we're going to get through today. And then the role of physical therapy and injury management of those injuries and some prevention and treatment strategies. At the end, we'll have a Q&A in which I have pulled some questions from the triathlon Reddit forum and where people have asked questions about injuries and try to recruit more of an online presence. So please reserve an appointment at dnaphysicaltherapy.com, and please follow us on social media on YouTube, Instagram, Facebook, Nextdoor, whatever pleases you. And then obviously at the end, please feel free to reach out with any audience questions as well. Okay, next. About DNA Physical Therapy, our mission and vision, core values, personalized custom care, one-on-one care, which is something I'm sure if any of you have experienced physical therapy now, it kind of feels like just like a mill, or you go in, you go out. You don't really get that custom one-on-one feel anymore. You feel like you're just a cog in a wheel. DNA Physical Therapy ease access to care for you. So we come to wherever you are flexible. I've met people in the park, met people in their gym, office, homes, and here in the clinic. Services that we offer: injury assessments, rehabilitation, performance enhancements, and specialized team sports as well. We organize good strength and prevention programs for swimmers currently, but we're working on getting some hockey in there as well. Which I'd like to bring up, if you're in the Carlsbad, San Diego area, I'm doing a free injury clinic for hockey players October 25th between 4 p.m. and 8 p.m. So don't forget to come to that. It's free, quick 15-20 minute assessment, see if if there's something that we can work with, or if I need to refer you out to something else. But don't forget. Next, let's talk about the difference with DNA physical therapy. Why are we unique? Why are we different than the other people? Ooh, look at that sunset in the background. Looks good. Customized approach. We have personalized treatment, good care, detailed background to meet your specific individual needs, listening, understanding what you're talking about, what you're feeling. That is unique to each individual. It's not just a scope. I don't see you as just a person. I see you as your whole lifestyle. So that's why we give you that detailed background. It's important for learning your custom exercise program or rehab routines to adapt to your individual needs as well. Where adaptable methodologies reach personal milestones, and of course the one-on-one sessions that I talked about in the previous slide: individual attention, tailored guidance, immediate feedback. The benefits of DNA physical therapy for athletes: faster recovery to target those muscles that are aching, injured, tendons, joints, accelerating the healing techniques, and minimize downtime so that you can get back out there in the pool, on the road, and in your running shoes. And then we can also maximize performance optimization, which during our treatment sessions, I'm always asking about your training, your diet, your supplements to make sure that you're getting everything that you need. And then obviously enhance mobility and strength. Something that I've realized treating with Ironman and triathlete patients in the San Diego Carlsbad area is you guys don't do much stretching. You do a lot of cardio, you do some strength training, but there's no stretching that's involved. So you guys are a linear athlete. You need to focus on getting the whole body moving together. And then improved endurance, long-term gains, sustained wellness, and injury prevention. As much as my business is physical therapy and I'd love it, my job is to work myself out of a job. All right, let's get into it. Stuff that you're here for. Common injuries with triathletes. So neck pain, let's start there. What are some causes from neck pain? Whiplash, strains, and fatigue. So we're in different positions when we are in the different phases of a triathlon, right? Swimming, head's usually down, tucked, turning, breathing side to side. That's very important and causes fatigue from training, strains from sleeping uncomfortably the night before, stress out about your race and you didn't have a comfortable sleep, you're in a hotel room, you didn't bring your pillow with you. All these things can cause neck pain. So common causes are sighting during swimming, especially if you're doing open water triathlons. So picking your head up when you're swimming, that throws off your rhythm, that throws off your balance when you're doing things, so it can cause that strain. And where does that come from? It comes from the neck initially and the upper back. So those are common things that I see from. The arrow position in cycling, when you're down in the narrow position with your head up and chin tucked, that is causing difficulty with some of my clients as well. So those are the two so far. And then a forward neck during running. So if you're running like this with your shoulders back and your neck forward, that's causing a lot of strain at the upper back of your neck versus your using your body and your core to give you that support. So common things that I prescribe is strengthening and mobility. And I have 3 preventative exercises right here for you. We've got chin tucks, shoulder shrugs, and wall angels. So chin tucks, I can give you a quick demonstration here. Back straight, shoulders back, looking straight ahead, and just pulling that head back. Look at that beautiful double chin. Beautiful double chin. So let's go from the side view. Same thing, back straight, shoulders back, head up, pull that shoulder or that chin back. That beautiful double chin right there. You can do either reps which I do in the car. It's very helpful and preventative, versus you can do chin tuck and a hold for 5 seconds. 3, 2, 1, and relax. 15 to 20 reps. That's the minimum you can do throughout the day. You'll still see some benefit, especially in the small intrinsic muscles of your neck. Shoulder shrugs. Basic, you can do that up and down, backwards, forwards. All those are great positions for you to do with shoulder shrugs. That's going to help strengthen your upper traps and your rhomboids in the back to help give you that stability and anchor that you need for all the exercises between the swimming, cycling, and running. And then wall angels is a classic. I love it. It's great for the whole upper extremities, I believe. Squeeze those shoulder blades in the back, hands as far back on a wall so you're touching and you're just doing snow angels, up and down. You can feel clicking and grinding in your shoulders, clicking and grinding in your shoulder blades in the back, and that's completely okay. That just means we're breaking up some of that tightness that you're feeling and working and making sure that you're getting that good mobility through the shoulder and scapula to help relieve some of that strain on your neck. Any questions so far? My crew in the back, any questions on the live chat? No, perfect. All right. We're flying through this, I guess. Here we go. Next, we got shoulder pain. Common injuries of triathletes and shoulder pain. Rotator cuff, common cause. Bicipital strain, another common cause. Strain muscles in general. The deltoid itself. So the rotator cuff, you got supraspinatus, infraspinatus, subscapularis, and the teres major and minor. Those are the big ones, and then you got the deltoid itself. And then you got your bicep tendon that runs in the front of your shoulder right here that always gets aggravated, especially when you're swimming, pinching that shoulder in the front, especially if you have the wrong hand position of where you're going. If you got your entering with your thumb down, you're really putting a lot of strain on that bicep. If you pick your arm up right now and lift it in that same position, feel right here in that bicep tendon, and you can feel that bicep tendon rotate with you with your hand position. So imagine if you're in this position and you're pulling down, that bicep isn't in a very good supported position. When it's even, it's got the most support. When you have it in this, it's also, you're not getting a good pull with your swim. And then when you're sitting on the bike, elbows high, tight elbows, or digging and riding and stepping up, those are also causing injuries on your shoulder when you're trying to get that power and momentum. Common causes of shoulder injuries are crashes, overuse, and muscular strength imbalance. And by muscular strength imbalance, I mean strong in the front, weak in the back, or vice versa. So the goal is always strengthening, mobilizing as well to get the universal comparison from anterior and posterior, lateral, medial muscle groups. So relief for shoulder pain, as much as I know triathletes don't like relief or downtime, rest is very key. And ice. Ice, I found, especially on the shoulder joint, knee joint, hip joint, is very important to, help calm things down, numb it up a little bit so you can start getting some normalcy back in your momentum and your movement. There's a lot of research out there that's saying that ice is negatively affecting you after an injury, but then you get another research group telling you that cold plunges are great. As you guys, I'm sure, know that it's all the craze right now. But these are all good things because ice does have beneficial treatment for recovery and rehabilitation. Also, the strengthening mobilization. It doesn't matter if you think you're hypomobile, which means you're hypermobile, where you're very flexible. Sometimes that over-laxity in one joint or in one range is different than the laxity you have in the other area. So I'm really flexible going out this way, but I have no flexibility basically coming out this way. So that doesn't necessarily mean that if you're flexible in one area, you can touch your toes, you feel great. That doesn't mean that your quads or psoas or anything is equally as flexible as well. So you have to monitor that, and mobilization and stretching helps with it. So here are 3 preventative exercises for the shoulder. We got the anterior shoulder stretch, which is basically a corner stretch. Let's switch the cameras here and see if I can do this. Ta-da. Let's stand up and show you the anterior shoulder stretch. So you can come to the wall, come in, And then 90-degree angle at your armpit, 90-degree angle at your elbow, straddle stance, lean into the wall and turn away. Hold this position for about 20 to 30 seconds. You should feel the pull right here on your chest. This is the single arm you should do. And obviously you want to do in the opposite position as well. 90 degrees at the elbow, 90 degrees at the shoulder, and turn away. Hold this for 20 to 30 seconds. And obviously if it feels good, that would be good to continue for multiple sets. Good. Next, we got the elbow push-up. Let's see if I can fix this screen so you can see my beautiful body. Do some elbow push-ups. So basically you get in the low plank position. Yeah. Still on the screen. Low plank, elbows and toes. Bring your chest to the ground and push back up. Chest to the ground, push back up. Just like you're doing a push-up, but just from your elbows. This is a great mobility for your shoulder blades and your scapula so that you're able to, let me catch my breath, so that you're able to get good movement and mobility out of that shoulder itself. All right. Okay. Any questions so far as I catch my breath? Okay. I shouldn't have moved the camera because the next one is shoulder taps. So I'll demonstrate that next. I feel fancy with this new thing. Thank you, Dylan. All right. High plank position starting on this time, touching the shoulders. Just shoulder tap. Notice how I'm not leaning side to side. I'm keeping my shoulder stable, keeping that shoulder blade in the back engaged throughout the whole time. I'm not sinking down. I'm engaging those shoulder blades in the back. 10 to 20 reps of that. Okay. Any questions? No. Perfect. Let's go. Don't forget to like and comment on the chat. Okay. Next, let's switch it up. All right. Nope, that's not the one. Let's go next, back pain. So we got back pain here. Some common issues that I see, obviously, are muscle strains in the back, multifidus, psoas, erector spinae, disc issues as well, herniations, bulging discs, degenerative joint disease, things like that are also common, but those can be more fear-mongering than anything. And then muscular compensation. So you could have a weak core, weak hips, tight core, tight hips can all lead to back pain. Common causes, most commonly in triathletes, is poor posture. Having those rounded shoulders forward flexed trunk, tight hamstrings, all that leads to issues with your back. As much as, like I was talking about before, about stretching, how important that is, that all can be stemmed back to back pain. Sometimes you can also overstretch and cause issues in your back as well. So don't forget to always be engaged in what type of posture you are holding. So swimmer posture, obviously everything is more forward or you're doing freestyle or front crawl in swimming positions, not really focusing on backstroke. So always your anterior part of your body is going to be the tight one versus the posterior chain of your body as well. Cycling, same thing. You're in that forward flex position, in that fetal position, basically, for most to develop that power in your glutes. Yes, you are engaging the posterior chain during cycling, but if you look at the rest of your body, it's all in the flex position. From your neck, shoulders, to your hips, you're in that flex position. So you're putting yourself at a very increased rate of tightness. Especially cycling takes longer duration, longer training time as well. And then you got the runs, which can cause back pain from running on different types of surfaces, on concrete versus trail versus beach, things like that as well. And then another common cause, crashes. So if anyone has any interesting crash stories, please share. Would love that. So some relief would be mobility and strengthening. This is going to be if you haven't noticed that common theme throughout all this, mobility and strengthening is very important. So some preventative exercises are the thoracic spine windmill, 10 to 15 reps of that on each side, prone press-ups, and side lying hip abduction, and single knee to chest. Would you guys like me to demonstrate that? I'm going to pause for a second so I can see if anyone is commenting on that and see where we are at, because I am nosy. Looks like my chat is disabled, so probably not. All right. That is great. All right. Let's see here. Let's get back to it. And here we go again. Boom. So thoracic spine, that's what T-S stands for the windmill. I will demonstrate. On your knee, straddle stance, and just waving, hi, how you doing? Looking like a windmill. Hi, how you doing? 15 times. It's easier to do it against a wall, so you get that feedback from the wall to keep it. Like right now, I'm feeling a little clicking in my mid back, near the shoulder blade, mid back. I feel like if I do it on the other side, I'm going to get a good pop. So I will demonstrate again. Oh yeah, very good. Some good stuff there. Next, prone press-ups is a common great exercise for patients with bulging disc herniations, anything like that. Side lying hip abduction is a good strengthening exercise for your obliques and gluteus medius, which helps keep your pelvis aligned while you're running, cycling, biking, or swimming. Single knee to chest is a good lumbar spine stretch, 15 to 30 seconds. And I'll post this PowerPoint in the comment or in the description below after this video is done, and you guys can click on all those videos and have access to it as well. Subscribe to the YouTube channel, and you'll have playlists as well that are, knee, neck, shoulder, hip specific, all the exercises pre-organized for you. Next, we got the hip. So, hip pain, common issues with triathletes, bursitis, IT band issues, and muscle strain. Muscle strain, most common issue at the hip is at the ischial tuberosity, at the booty, right there, from where the hamstring inserts. IT band issues comes from weakness in the gluteus medius, weakness in the glutes themselves, and overuse, especially if you feel that pain at the hip and knee area. Bursitis, overuse issue, inflammation, irritation, stress-induced as well. Causes: overuse, muscle compensation, aka weakness, and crashes. Next, what do we do for that? Relief, modalities. What are modalities? Ice, heat, ultrasound, TENS, electrical stimulation, all things we can provide here at DNA Physical Therapy. And we can provide you with strengthening exercises and mobility exercises. Mobility, what is that? Stretching. Now, preventative exercises, we got the monster walks, bridges, and single leg RDLs. So let's demonstrate these, because these are fun, and you guys will probably be able to see how out of breath I am. So let's continue that trend as I overheat in my hoodie. Also, this is a new hoodie. DNA Physical Therapy logo, and then all my info in the back. Ta-da! All right, let's move some of this out of the way and adjust the camera. Good. So for monster walks, you're going to need a resistance band like this, easily provided on Amazon, which my sister currently works for, so go support it. Wrap it around your ankles. Keep tension on the band. Let's waddle back here. Tension on the band. Get in a low squat position, high squat position. Step outside your shoulder width, keeping your toes pointed forward, leading with your heels. Tension on the band. Small step in. Out and in. Out and in. And then back and forth. There we go. Feeling it really in the glutes to the side here. Demonstrate from this angle. Very good. Monster walks. 3 to 5 big steps in each direction. Really get those glutes firing and going. Bridges, I'm not going to demonstrate because those are simple exercise that you can follow on my YouTube channel and you can see that video. But let's demonstrate single leg RDLs or single leg Romanian deadlifts. Everyone's been asking me what they stand for, so that's what it stands for. Balance on one leg, keep one leg slightly bent, back straight, shoulders back. Slowly go forward, touch your toes, and come back. I got plenty of room. I don't know why I'm jamming myself in the corner. Move the stool, bend that knee, touch the ground, come back up. Hips and legs rotate together. All right, let's switch back. All right, back to this beauty. Okay, let's go to the knee pain. So common injuries that I have with clients with knee pain: patella tendonitis, bursitis, quads strains, ligament tears, strains, and meniscus tears as well. And an extra bullet for you to throw in whatever you like. So patella tendonitis, bursitis usually is indicated from overuse, poor positioning of your seat on your bike is another calm for patella tendonitis and bursitis. Easy fix with adjusting the seat height, icing, and rest. And braces actually help the most with patella as well. Only time I usually recommend a brace as well. Quad strains, cyclists, you guys got the best quads I've seen out there. So that's a common use from a overuse, muscle strain, tweaking, doing something else other than cycling, but you feel it the most in cycling is at the quad. So eccentric mobility at the quad helps reduce that pain and prevents that quad from tearing or becoming strained in the future. Ligament tears or strains, those are usually caused by crashes or accidents. You usually don't see those just willy-nilly. Meniscus tear can be overuse, but also mostly with crashes or running on hard surfaces. So muscular imbalance, upper lower extremity versus lower extremity. So if your quads in the front are super strong and your shin, your tibialis anterior, is super weak, that can cause issues at the knee joint because the muscle imbalance is pulling on the patella tendon versus your lower extremity tibialis anterior isn't giving that equal strain on that knee joint itself. So thus you have the tendonitis that develops. So identifying that muscular imbalance is important so that you can train that, so you're able to get that, decrease the risk of that happening in the future, or making sure you recover from that injury as well. So some relief ideas: downtime. Let's be serious, you guys won't do that. Strengthening, mobility, and modalities. Again, modalities, like I said before, ice really works at the knee pain, especially if it's a tendonitis or bursitis kind of issue, and if it's swollen. Preventative exercises for knee pain: wall sits with heel raises, boom, boom, boom. Sideline hip adduction is in this, and Swiss ball squats and the lateral lunge stretch. So let's demonstrate the wall sits with the heel raises. Miriam, can you toss me that tiny ball too? And we'll demonstrate this while it gets going here. Thank you. Whoop. We'll leave this to demonstrate. First thing we're going to demonstrate is the wall sits with the heel raises. So which wall is perfect for this? Right here. So get down in that 90 degrees of hip flexion and knee flexion. And then I'm going to slide and kill myself. So I'm going to get this hopefully to help me from doing so. There we go. 90 degrees. Fuck. You okay? Yep. So just watch the video. Excuse my language. Next, let's demonstrate Swiss ball squats. Hands leaning against a small ball. It doesn't have to be this small ball, but a ball that you have. And come down and up. Down and up. Really focusing on the quads, engaging the quads and the glutes. The quads are really going to be engaged because you're sitting back. I don't want you leaning forward. You're really leaning back into the wall. All right? Okay. And then next, the lateral lunge stretch. Wide base, step out, lean into it. Feel a good stretch on this side of your hip right here. And if that's too intense, just bring that knee down and you can do the stretch that way. If you have tight ankles like I do, your heels won't touch the ground, but that's okay. And then same thing on this side. Feel that stretch in your groin and inner thigh. Sweet. I hope no one was on the live stream when I fell. All right. Great. Next, let's go to DNA physical therapy and injury management. So early intervention is very important. The role of early diagnosis. If you're feeling an injury, don't let it develop over time because that can build. Consult with me, 15-minute consulting sessions at dnaphysicaltherapy.com. See if you need to go get imaging, go to orthopedic, or just come in for a physical therapy examination. Minimizes downtime. So if you're injured, come to physical therapy sooner rather than later. We can usually help you decrease the amount of downtime that you are in out of your sport. And then physical therapists in California, you got direct access. You don't need a referral from a doctor because we are doctors, and you can schedule an appointment ASAP. These are two references I have for you guys to see how important physical therapy is in relation to triathletes and swimmers because I'm a swimmer. All right. Next, importance of PT and injury management, rehabilitation, importance of consistency, and treatment. Consistency is anything but the most important thing. I can tell you what to do, but it doesn't mean if you're not doing your exercises at home or if you're not doing consistently, it doesn't mean you're going to get better. So consistently is key, and that's something I reiterate with my clients all the time. PT can also help with performance enhancement, techniques for better performance. Custom approach with DNA physical therapy allows that. Personalized program may seem generic, but the personalized program, we identify your deficits, and we work towards you to get your performance to be optimized and recover faster. And here's some references right here for you for some evidence-based practice. And then monitoring progress throughout each session that you're in here. I'm asking questions. How do you feel after your last session? How do you feel in the water? How do you feel on the bike? How do you feel on the road? How do you feel in your shoes? These are all questions every therapist should be asking throughout your recovery and your training process. Next, DNA prevention and treatment strategies. Obviously, mobility, stretching, and flexibility is something I've been reiterating throughout this presentation. And then here's another article that I found that reiterates how important stretching is for sports performance and injury prevention. And then obviously recommended routines that we have on DNA Physical Therapy YouTube channel. Strength training, Core strengthening, static and dynamic, is always important. Doesn't mean that you're strong in a low plank position doing nothing. It means that's going to translate into swimming, running, or cycling. Muscle balance, as we talked about before, anterior chain, posterior chain, lateral chains as well. Posture correction, importance in injury prevention and techniques like we talked about before, especially in the cervical and upper back and the low back as well. Range of motion treatment offers. We offer exercises, stretches, and manual therapy here at DNA, and we have all the modalities that your heart can desire. All right. Next, any questions? Since my live chat isn't working, I'm sure no one can ask me questions. So let's go to the Reddit ones. So here is the first Reddit question I have, is a swimming crossover. Posting here as a cyclist, but thought it was sub might have more insight. I'm a cyclist with knee injury, 2.5 months out from my biggest event, likely not cycling for 2 weeks, wondering what people's experiences are with swimming training to at least maintain cycling fitness. Is there much crossover, or is it am I wasting my time? Nothing I can't do long sessions like I would on my bike. Pissed with myself with the whole situation. Tia. So Tia, cardiovascularly, there is carryover, but if you're looking for fitness with long duration cycling, obviously there's not going to be good carryover. Stationary bikes or on a trainer with light resistance, is that something that's possible for you to do? That's a recommendation that I would have. And if you're really crammed before your big event, I would go see a physical therapist ASAP that can teach you some compensatory strategies. Like a couple weeks ago before Kona, I had a client. She had labral tear in her hip that was causing some hip bursitis that she was able to push through the labral tear, but she wasn't able to push through the bursitis. So we were trying to get her back on the road to running again because she wasn't able to train like 2 weeks out before her Kona Ironman, and we ended up getting her back. She was able to finish the race, obviously with some limitations, but she did it. So there is some crossover, and it is possible to compete in your event even with an injury a couple weeks out. All right, next question. Tips for tight soleus when running. I started running again a few months ago after an injury. During the injury, I rediscovered swimming and cycling. So I'm building a base to maybe get into triathlon, sprint triathlon during the beginning of next year. I used to have a lot of pain at the top of my Achilles tendon when running, for which I consulted a sports doctor. He recommended to stretch my soleus, gastrocs, hamstrings, and loosen it up. I did this religiously during the past 4 months with great results. My running style improved a lot. However, I still experience very tight soleus muscles during some of my runs, despite stretching them every day before and after runs. Currently, I'm running 3 days a week, around 25 minutes per run. I add 10% each week with a rest week every 4 weeks. Do you have any tips or experience this to help relax my tight soleus? My next step will be dry needling. So my next step for you, loop lopsided wile guy, is strengthen your soleus muscles. So an easy exercise for you to strengthen your soleus muscles is going to the gym, or if you don't have a gym, go into a stool or stair and just doing heel raises, lifting those heels in this position. So having your knees bent, we're working the deep muscle, which is the soleus. When you're standing up, we're mostly focused on stretching and strengthening the gastrocnemius muscles. So that's why we need to strengthen the soleus. So if you don't have access to a gym, putting weight, leaning forward on those heels as well will strengthen those soleus. And if you do holds while pushing down with your elbows on your knees, it's a good isometric exercise as well. But obviously, I would recommend doing this in the gym on the seated chair exercise specified exactly for the soleus muscle. All right. Whoop. Again. Dumbest way you got injured in triathlons. Well, I posted this one so I could get stories from people in my comments, but it's not working. So this one was a kind of a wash. What's the dumbest way you've injured yourself in this sport? I'll start. I pulled a muscle in my back shimmying into a too small cycling bib. That's hilarious. That's all I have to say about that. But I've hurt myself in stupid ways as well. Yeah.
That's so funny. You want me to
Yeah.
share?
Please share.
You want me on camera?
Yeah. I'm on camera.
Plenty of crash stories.
It's my boy Dylan.
Heyo.
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 So I'm a former semi-professional downhill mountain biker. Raced D1 varsity in college. Raced at a professional level outside of college, and I have plenty of crash stories. One that's like related to racing. I was in a race. The race came down to like the final like field sprint, so everybody was just sprinting to the finish line together. Unfortunately, I was caught mid-pack at that point because I was not in peak condition, so I was not in front. And two guys ran into each other directly in front of me. So I flipped over my bike because they were just laying in the road in front of me, and I sprained my left AC joint and broke my collarbone. That was a fun one. I've also...
How long was that recovery from that?
That recovery was probably like a month and a half.
How young were you?
I was 18 at that point, so...
Age also has to deal with that, okay?
Age has to do with it.
Recovery, yeah.
There was, later that year, I fell off my bike and flipped over the handlebars again. I fell 20 feet straight to my head. So that, you want to talk about the neck pain?
Yeah.
There was some neck pain there, pretty bad concussion. I had to stay in bed for a while. So luckily there's not a ton of concussions in triathlons because those are kind of sketchy. But there is plenty of like muscle injuries that occur, and Dr. Nader was able to really help me out. Recently my back went out and he got me back on the bike within a couple weeks. So you can definitely attest to his skill set and his abilities as a PT. So definitely reach out. And
you did a cycle up from Oceanside to La Jolla and back?
I did about 60 miles, like 2,500 vertical feet. So not a ton of climbing, but definitely some steep sections. And, a few months ago, I wasn't able to ride. So he's helped me out a ton. Yeah.
Thank you, sir.
Thanks for having me.
My pleasure. All right. Let's go next. I think this is the final one. Knee pain on the TT bike. So just purchased a new TT bike and the front of my knees is killing me on and off the bike. I read it could be due to cleat placement, but I haven't changed my placement in 2 years. Could it be too low of a seat? Maybe the paddles being too loose with side to side momentum. So this comes up to what I was talking about before, about seat height position. Obviously that's important. Cleat position is also important. For this person, I would recommend going have a friend or someone videotape you and send it to me via the virtual chat or virtual consultation, and we can talk about how it looks and we can go from there. Thanks, Mark Stevens. All right, thank you. Any questions in the comments? Marianne? No comments. Okay, so let's go. Don't forget to reserve an appointment at dnaphysicaltherapy.com. Special offers, free one-on-one 15-minute virtual sessions. Also virtual sessions online anywhere in America that we can work together to get you back. I'm licensed in most of the states and working on the other 50. Next, let's go 10% off with a review on Google or Yelp. And then please go to Shoulder Rehab Toolkit. You get a 5-week exercise program that has exercises you can add into your strength training and resistance program to prevent shoulder injuries. And we have package deals. And if you refer a friend and they reserve an appointment, you get a free visit. Don't forget to like and subscribe to this channel. And thanks. Heyo.